So everyone knows what it means to be a cancer thriver or a survivor, meaning you're somebody who's living with cancer, being treated for cancer, and or have gone through some sort of cancer. Now you're on the other side. Being a cancer previvor means you now have found out that you have a genetic mutation that radically increases your lifetime risk of cancer. And so all of the treatments and measures you're taking are more proactive to reduce the lifetime risk of cancer.
So they're more proactive than reactive. I'm Riley Reese. This is the Sofia Unfiltered Podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everyone, and welcome back to Sofia Unfiltered, where we bring you inspiring stories from health and wellness experts. I'm your host, Riley Reese, and today we're honored to have Dr. Simran Malhotra with us. Dr. Malhotra is not only a dedicated physician and triple board certified, but she's also a BRCA previvor, a powerful advocate for preventative health. She's here to share her personal journey, her expertise in medicine, and how her experience has shaped her approach to patient care and wellness. Let's dive into her inspiring story and learn how she empowers others to take control of their health.
Great. Thanks for having me here.
Yeah, thank you so much for being here. We're really excited. You know, Breast Cancer Awareness Month is here. And so we're just really honored that you're going to be here to share your story. We can't wait to jump into all of this, right? So really physician turned patient. There's a lot. Why don't you just tell our listeners a little bit about your background?
Yeah, for sure. Well, first I'll say I have an intimate connection with the name of your podcast because my daughter's name is Sophie. So when I saw your request, I was like, for sure, this is meant to be. Sophie means wisdom, and I'm pretty sure Sophia does too. So
yep, Sophia means all wisdom. Yeah.
And my son is Sage, which is also wisdom. And what I hope today is that we can share a whole lot of wisdom surrounding breast cancer and empowering women on all the things that are actually in their control to reduce their risk. So yeah, as you mentioned, I'm a triple board certified physician professionally. So I did my training in internal medicine, hospice and palliative care. So for people that are not familiar with that, I essentially for almost a decade took care of people living with serious illness, oftentimes at the end of life, and then lifestyle medicine. Those are all things that most people are not familiar with. So lifestyle medicine actually came into my life when I became the patient. So 10 years ago, I was 26 and found out that I carry a genetic mutation, as you mentioned, the BRCA1 mutation. Cancer and I have been pretty close since I was a kid. My mom was diagnosed with breast cancer for the first time when I was 13 years old. And over 10 women on my mom's side of the family have had either breast or ovarian cancer. So that's where this genetic mutation comes in. For the average woman, her lifetime risk of breast cancer is about 12%. If you carry the BRCA1 genetic mutation, the lifetime risk for me was 87% for breast cancer and about 50 to 60% for ovarian cancer. And so when I was 26, I found out about this genetic mutation. It completely turned my life upside down. At the same time, I was just starting my fellowship in palliative care and taking care of really, really sick people, oftentimes, near the end, and some of them even with the same genetic mutation as me. So it was a pretty wild ride trying to navigate becoming a patient, but then also caring for the most vulnerable people. And then in addition to that, I'm a mom of two. I'm a wife, originally Canadian. So we can get into some of the details of this story, but in a nutshell, that's me.
Yeah, I mean, that's amazing, right? So did you find out, so you were 26, were you already doing, like you had just gotten done with med school? What really triggered you to check for this genetic mutation? And for our listeners, it's the BRCA1 is actually what you found out. And I guess you did a screening. Do you want to tell our listeners a little bit more? It's also called the BRCA. It's also, you want to tell people a little bit about it? They may know it as the...
the Angelina Jolie mutation. She kind of came out with it several years ago that her mom carried and she had gotten these preventative surgeries. And that's kind of when people really started talking about it in the mainstream media. But for me, it was, my mom was first diagnosed at 33. At that time, I was 13. She got genetic testing, and the genetic testing panel did not show anything that she carried a mutation. Fast forward several years later, 2014, I was doing my residency in internal medicine, and another family member got really, really sick, this time with a very serious cancer. And so that just raised some red flags. I have a South Asian background. And so over the years, I've heard about different family members, women on my mom's side of the family who were getting sick, but we don't ask questions. Everything seems to happen behind closed doors. Even I remember my mom's cancer diagnosis, there were no support groups. There was no talking about it. There was no checking in on her. It was just like, get chemo, get surgery, get radiation, and this chapter's closed. Let's move on. And that's, typically in our culture, it's quite taboo to talk about cancer and disease and death. And, hence the reason why a lot of people don't end up seeking preventative care and screening and such. But for me, I was a doctor, and I had all the knowledge, and I had access to colleagues who I was able to talk to and tell them my story and my situation. And all of them suggested at that time, after my mom's sister's diagnosis, that she should get genetic testing again, because genetic testing has come such a long way. And even now, we are discovering newer genes every day. And so she got genetic tested again in 2014. And at that time found out that she carried the BRCA1 genetic mutation. And then basically a year later, I was about to get married and decided to get tested before I got married so that my husband would really know, be fully informed into what he's getting into. And I found out that I carry the same gene as my mom. And just to clarify for the listeners who are not familiar with this, like BRCA1 and 2 are actually oncogenes, which means that we all have these genes, but they're protective genes. So they actually protect us from getting certain cancers like breast and ovarian and prostate and pancreatic cancers and a few others. And so when you have a mutation in this gene, then you are at a radically higher
because you're not as
getting
quote unquote protected.
Exactly. Because you don't have the oncogenes, so you don't have the protective genes. So you essentially are at a radically increased risk of getting these cancers.
Okay, great. So you're talking about genetic testing, and you're talking about how far it's come. For our listeners out there, right? Even for me, I mean, do we just go 23andMe? Like, what types of tests? I mean, and there's so many different types of tests. Like we hear a lot about for like the, colorectal cancer. There's a lot of tests we can do now, sending samples in. Are there some that are popular that you recommend specifically for the BRCA?
I actually just did an expert review on an article on all things genetic testing.
Oh, awesome.
At home tests.
Yes.
And what I would say is the first thing that's really important to do is gather the information, right? So look at your family history and note any patterns, like who had cancer, if they had cancer, at what age, what kind of cancer, how many people, and these are all the things that you can then take to your doctor and you can decide, like, does it appear that you might have, a hereditary risk in your family? And keep in mind that, these genetic mutations only account for 5 to 10% of all cancer cases. So most people actually don't have these genetic mutations. But if you do, it would be life-changing to find out that you do. And so, before you just order any test, I would really, gather the information, talk to your doctor. And the best thing to do would actually, if you determine that you are at high risk of any one of these, and there's multiple genes, BRCA1 and 2 are just the most common, but there are several genes now that have been identified. If you find out that you might be at high risk, then the best next step would be to go see a genetic counselor and get like a full panel genetic test done through them, because most of these, like 23andMe, they don't identify like all the genes. It's only a handful. And
right,
so
exactly, which is why it's hard to, is what we're talking about it, right? Like, where do we go? Like, we have all this information at our fingertips, but what's exactly the right one that we're looking for?
Well, and that's the thing that sometimes worries me about, it is really cool that we have all of these resources that we can just get to our house and send off in the mail. It's very cool. But the part that worries me is just, if someone really does have a high risk based on, their family history, and then they do a 23andMe and it says, oh no, you don't have this gene, then they may just go on living their life and think, okay, I'm fine. But in reality, it may have been a gene that was not tested for, or a specific part of the gene, right?
You're right. That's terrifying. Yeah. Yeah, that's good. So basically get your information together, talk to your primary care physician, see what they would recommend.
Yeah. Or even best is go see a genetic counselor who will really map out your family history, a family tree, and you'll be able to make a really informed decision based off of that.
Yeah, that's a really good idea. I mean, every doctor's appointment, aren't they already asking you, like, what is your family history? So if you start marking this, like, hopefully they're taking that into consideration and recommending all of this anyway, if you start writing stuff down. I mean, I hope so. I mean, I know doctors are limited on time, right? But
yeah, and I think that's, this is really going to be something that you'll hear me say over and over again, is that, you have to advocate for yourself. You know that, and I know that, especially in the healthcare system that we have today. Unfortunately, like you said, most primary care doctors, just don't have enough time. And so this is something that could easily be missed, especially if, they're not worried that you have cancer right now. Right. And so you don't want to wait until they're worried you have cancer. You want to pick up on these red flags way before so that you can do something about it. So
maybe bring it to their attention. Maybe don't wait till your 1 year visit, message them. I mean, it's as easy as messaging now, right? To a lot of your doctors, like message them and say, hey, I noticed this, this, and this. I mean, get an appointment, do what we have to do, right? To advocate for yourself.
Absolutely. And, different people come from different family backgrounds, different cultures. They will or will not talk about different things. I mean, it took me a very long time to weave through my family history. And so that in and of itself might be, a puzzle to put together for you. So
yeah,
I think start there and then go from there.
So you're 26 and you got this, got the test done, and then you found out that you have this mutation. You had a lot going on with your fellowship. You're about to get married and you got this information. Can you just walk our listeners through like what happened next?
I would be lying if I didn't tell you that those were some of the most debilitating months of my life, because I found out about this mutation and all of a sudden, and this is the other thing, if you are going to get genetic testing, I think it's very important to point out that you have to be in a mental and emotional place to be able to receive what the results might mean if they're positive, because then you are thrown a whole slew of life-changing decisions to make. And so I'm 26 and I basically find out about this mutation and I go to the oncologist and the breast surgeon and the plastic surgeon. I mean, I met a whole bunch of people, and essentially I was told that in the next 5 years, right, by the time I'm 33, because that was the time my mom was first diagnosed with cancer the first time, I was told in the next 5 years, I basically need to, have children, get married, have children, be sure I was done having children, and then get a risk-reducing mastectomy and consider getting a hysterectomy. So the idea of, putting myself into menopause, the idea of how many children do I want, having to work full-time as a palliative care physician, caring for dying people every day, many of them with cancer, not being able to stop working because I'm Canadian, I was on a visa at the time, and then also being married to an ICU physician whose schedule's crazy, and all our families in Canada. I mean, all of that led up to 2020, and then 2020 happened, and we all know what happened there. So I don't know how I survived most of those days. I think it was more like I didn't have a choice. So I just put my head down and just took one step in front of the other.
One day at a time.
Yeah.
You're surviving one day at a time. That's one moment at a time. I mean, 'cause this is like life-changing, world's upside down, do everything now. I mean, thank goodness you're about to get married. I'm just like, oh my gosh, for those of us that got married late or had kids late, these are huge decisions. And you're just like, and I'm working every day. Like, I can't even imagine. So, my background, pilot, but also as medical, I, served in the military. So I got to be a flight nurse, but we worked in hospitals. Like, I worked on some of our military hospitals, like the 5th floor. Palliative care is hard. So if you haven't been in that, like it is brutal. It is not for me. It is not for everybody. So I just really commend people who can do it. But I just, I really, instead of just looking at it to care for them, I would empathize, and it's heartbreaking. So I really understand when you had to go face people in that position. I cannot even imagine how you weren't putting yourself in this position. Like, oh my gosh, I could have cancer.
I mean, there were so many days where, I sometimes thought I was looking in a mirror.
Yep.
And it got harder because after I found out about my mutation, I got married, and then we were in a rush to get pregnant because, I was given this timeline.
Right.
And so I got pregnant, and, got pregnant, and then 9 months later got pregnant again. So my daughter was 9 months old when I got pregnant with my son.
Knocking them out.
And at the same time, my mom was diagnosed with cancer again, with breast cancer. Actually, the same month that we were celebrating her 15 years cancer-free from the first cancer. Sorry, chills. I don't recount these memories that often, but it was insane to try to navigate, caring for my dying patients, being fully present, but also not completely putting myself in their shoes.
Right.
So that I would be disabled by the fear of what could happen to me. And then navigating early motherhood, being pregnant, breastfeeding, pumping, sleep deprivation, trying to be there for my mom. I mean, it was insane. It was insane. And that's why, who I am today, once you understand the intricacies of my story and everything that I went through, it makes a lot of sense why I am who I am today and why I value what I value. And so even though those were some of the hardest days of my life, and it brings me to tears every time I think about it, they literally were the foundation to who I am today. And this is the strongest, most empowered person I've ever known. And if I didn't go through everything I went through, I wouldn't be who I am. So I don't regret it.
It's a journey. It's a journey, right? Life is a journey. We all have different journeys, right? And that's why we're just really, it's pretty cool that you get to share this with our listeners. We're very lucky to hear this, right? Because it's just an interesting perspective, and you've had a very interesting journey, that's for sure.
And your life perspective and your life experiences shape a lot of your beliefs, right? And your focus. Right. And so for me, it was when I found out about my mutation and then the subsequent years of everything I found out I could do to control my risk of cancer, I always saw all of that as a blessing in disguise, because it was a choice. I was given choices that my mom did not get, that so many of my patients who passed away leaving their young children at the bedside did not get. But if they got that choice to make proactive decisions for their health and to be even alive today, they would have taken them in a heartbeat. And so for me, I'm yes, this was the hardest thing I've ever gone through. And, yes, it sucks that I had to have surgeries and get rid of all of my female parts, but I'm alive. And today, actually, I'm, 3 years older than my mom was the first time she was diagnosed with cancer. And that is a blessing.
Yeah, absolutely. So what were your choices for any of our listeners who may have just gotten the news or have this mutation? What all did they say to do besides, you had to have the kids, then I'm assuming that you had all of the surgeries. Is that right?
Yeah. Fast forward to 2020. And, so let's go back to to the concept of a previvor for a second, because that really ties into this. So everyone knows what it means to be a cancer thriver or a survivor, meaning you're somebody who's living with cancer, being treated for cancer, and or have gone through some sort of cancer. Now you're on the other side. Being a cancer previvor means you now have found out that you have a genetic mutation that radically increases your lifetime risk of cancer. And so all of the treatments and measures you're taking are more proactive to reduce your lifetime risk of cancer.
So they're more proactive than reactive.
Exactly. And so I am a cancer previvor, right? A BRCA1 previvor. And so for me, like from the time I was 26 and met with that team, they started telling me all of my options in terms of surgeries, right? So the recommendation was I should get a risk-reducing preventative bilateral mastectomy before the age of 33, which is when my mom was diagnosed. And then that came with a slew of options afterwards, right? You had the option to do, reconstruction with implants, options to do reconstruction with deep flaps or using your own tissue to reconstruct breasts. And then, do you take out your ovaries at the same time? Do you wait till you're 35 or 40? They have some general recommendations, but then you really have to personalize it based on your family history, risk, and all of that. So I had a few years. So during that time from when I was diagnosed to 2020, so that was like 2014, 2015 to 2020, over those years, my husband and I, from time to time, would bring this up about like, okay, what do we want to do? What are the options? And I really did my research, really did my research, including going through the scientific journals of what I should do, all the way to like actually talking to women who had, the same mutation as me, who also had cancer, who went through the different surgical reconstructive options, who were living with premature menopause, from getting a preventive hysterectomy. So like I did my research, and what I want to really emphasize is that it's a gift of being a previvor is you have the gift of time. Whereas when you're diagnosed with this cancer, it's like one thing after the next, right? So you don't really have time. So you can't make as informed decisions as you really can as a previvor. So ultimately for me, fast forward to 2020, the height of COVID, I decided to get a risk-reducing bilateral mastectomy with something called aesthetic flat closure. So essentially it means I went flat. I decided not to get reconstruction. And then I also decided at the same time to get a total abdominal hysterectomy, which basically means, I got my uterus out, I got my fallopian tubes and my ovaries out. So putting myself into premature surgical menopause. Now, I don't know if you want to get into why I made those choices, but there's a lot to say there as well.
Yeah, I mean, I would love to hear that. I mean, I'm sure our listeners would love it if they're on the fence of trying to make these really difficult decisions, sure. If you're willing to share.
Yeah. I found it really fascinating when I kind of started to realize that I wanted to get aesthetic flat closure or go flat after mastectomy. I found it shocking how hard it was to advocate for my body. I had multiple appointments with plastic surgeons, and pretty much every single one of them, as soon as I went in there, it was like, and I met with them because I had to meet with them. The breast surgeons said I basically had to meet with them. And pretty much every time it was like, oh, you're young, you're beautiful, you're like the perfect candidate for direct to implant reconstruction, or, you don't have enough fat on you to do a flap reconstruction. So I literally was told go on a donut diet to gain enough weight to do a flap reconstruction, which I found crazy. And then one of my doctors actually said to me, and after this appointment, I literally left out of that office in tears. She literally said to me that if you choose to go flat, you are going to be psychologically scarred. And not a single one of my doctors took the time to listen to why I wanted to go flat. And this empowered me even more to tell women that, it's your body, you know what's best for you. Doctors are amazing. And I'm a doctor, but like they are experts in disease management. Like they are not the expert in you. You are the expert in you, and you know what's best for you. And, for me, it was very clear after doing my research and talking to so many women. My mom had a deep flap reconstruction. So I saw it intimately, very up close. And it was very clear to me that I was always a small breasted woman. My breasts never really were the centerpiece of my confidence, at least. Right. And I felt like they did what they needed to do in this lifetime. Like they
breastfeeding.
Right. Yes.
Babies.
Right. They breastfed 2 beautiful, healthy babies. And I have been in the medical system, and I am privy to medical errors and complications and all of that. And I just didn't want to risk any more complications. And I didn't want to have multiple surgeries. And so it was just like my pros and cons list was very clear. But I think the hardest part about making that decision was not having the support of my medical team. And so, if it's possible and available, if you have a team that is not on board with your choices and what you feel most comfortable with, go find another team of doctors, because that's what I did. So my second opinion set of doctors is ultimately who I went with. And I think when it comes to the total hysterectomy, that was probably, I was comfortable with living a boobless life. Like I was comfortable being flat. My boobs pretty much shrunk after I breastfed you anyways.
Do you have any left? You got none left. Okay, there's nothing left. So for those people who have them, I wasn't one of them either.
I was very comfortable with that. I think the hardest part about my, surgical decision making was really the choice to put myself into surgical menopause.
Yeah, that's a mental hard block. That's hard too.
Because I was 32.
Yep.
And so that was really, really hard, especially because, as a doctor, I know that putting myself into menopause also meant that I was really increasing my risk of heart disease and dementia and, osteoporosis. And what I was really, really scared of, because after my mom's first cancer diagnosis, ultimately, my parents ended up getting divorced. She didn't really know what to expect with surgery. She went into chemical menopause from chemo, and she didn't understand what all of this sexual dysfunction and all of that meant. She didn't ask for help. And all these years later, I understand now the impact it had on their relationship and maybe some of the reasons why they got divorced. And that was my biggest fear, because I have a phenomenal relationship with my husband. And I think that was my biggest fear, is how could this impact not just my health, but my relationship with my husband?
Mentally, I mean, I know a lot of people who get hysterectomies and they don't get any hormone replacement therapy. You are in a bad spot, right? Your hormones are just all over the place. And I think that is terrifying, that you could go in and not get what you need on the back end of a surgery and then be left with just your hormones just out of control. That's terrible. And it can destroy all sorts of friend relationships, family, spouses. Yeah, that's scary.
Yeah,
it sounds like you had the team, you asked the right questions, you had the support.
As soon as
you got the treatment you needed, right? You don't just have all the pieces taken out with nothing put back in.
As soon as the gyn-onc walked in the door at my first visit, my husband and I were so tearful. We were holding hands. And the reason, going back to the reason I decided to have it at such a young age, because the recommendation, even with BRCA, is actually to get the hysterectomy and oophorectomy between 35 and 40. And I was 32. But the reason I decided to go ahead and just do it is because the youngest woman in my family is actually 30 years old when she was diagnosed with ovarian cancer. And so my team agreed. Yeah, my team agreed. You're down with your kids. This is the best choice for you. And having seen the amount of ovarian cancer I've seen, it is a scary disease. There's no good screening for it. And it made sense. So I was sitting on the table and the gynec walked in and she could see that both of us were scared. And she was amazing. The first thing she said is like, what are you most scared about? And I said, well, I'm worried about how menopause is going to impact my sexual health, my mental health, yes, all the other things too, my heart, my bones, my brain, but like really like, how's it going to impact my sexual health and my mental health? And how's that going to impact the relationship with my husband? Right. And the first thing she said was like, you are going to be fine.
Yep.
You are going to do so amazing. None of those things will be impacted because we are actually going to put you on a low dose transdermal estrogen patch and you are going to be fine. And that was the first time where I was like, I can be on hormone replacement.
Exactly. Hormone replacement. So everybody who's listening, if you're in this position and you're thinking about taking any of the pieces out, you have to think about the replacement, the hormone replacement on the backside, because it has happened, personally, firsthand. People who've had stuff taken out and the doctors don't even mention hormone replacement. And that is just scary to me. Sometimes you don't know to ask either. Like, how would you know to ask? You think you're in good hands when you're having something taken out, but it's not always the case.
Well, it's a whole generation of doctors who started fearing hormone replacement because of the, WHI study that came out decades ago now. However, in reviewing the way that study was looked at and everything, we now know today that hormone replacement therapy can actually not only improve women's quality of life, but help reduce the risk of all these complications like heartburn,
the brain,
sexual health, mental health. I'll caveat, obviously it's not medical advice, but it's not for everybody. So if you've had a diagnosis of breast cancer before, they will not offer you hormone replacement, but we're talking specifically in a situation where if a woman is otherwise healthy and she's going into natural menopause, or for some reason she needs to get a hysterectomy, or even for genetic mutation carriers. And there are studies now, pretty good studies, where they followed women, with genetic mutations like BRCA for 9 or 10 years. And they saw that starting them on a low dose hormone replacement patch after a preventative hysterectomy does not increase their risk of, getting breast cancer, especially obviously if they had a mastectomy. So I think that is an eye opener. And I will also say, this is where it all ties in with everything else I'm passionate about, is I have met several women who did exactly what I did, and are on hormone replacement, however, continue to have the debilitating, emotional roller coaster and the vasomotor symptoms and all sorts of other side effects from going into surgical menopause. And that is where I think the other staple part of this is our lifestyle. Our lifestyle habits can have a huge impact on our quality of life and our experience in menopause, whether it's premature or natural. And I just don't think it's talked about enough.
Yeah, absolutely. So can you just tell our listeners really quick a little bit about what you are doing now and how you are empowering your clients?
So I think, just going back to like breast cancer, right? Or even menopause, if you want to talk about it, there's a lot of things that we can't control, right? We can't control being female. We can't control, and we don't want to control. Like being a woman is amazing. Women are the most fascinating creatures alive with everything we're able to do.
Absolutely.
But we can't control our age. We can't control our breast density. We can't control if we have an inherited genetic mutation. But there's a lot of things that we can control, and this was kind of the pivotal mindset and focus that I really took on my journey, that, hey, there is a lot of science and a lot of evidence to support that the everyday things that we're doing can not just reduce our risk of breast cancer, help us live better in menopause, but then they can also help us reduce our risk of the number one killer in women, which is heart disease. They can help us manage a healthy weight. They can help us with our mental health. They can help us reduce our risk of metabolic syndrome. And it's all interconnected. That was the crazy part for me. And
so this is really where it tied into what you were doing before with your lifestyle medicine, right? So this is where this played a huge factor, right?
No, because I only found lifestyle medicine because I became a patient.
Got it.
I found lifestyle medicine because I became the patient. I asked my doctors, that was one of the first questions because, at 26, when I found out about this genetic mutation, remember I wasn't married.
You were only in the fellowship for palliative care.
I was only in the fellowship for palliative care. And so what I asked my physicians was, hey, look, I hear you saying I need to get all these what I will in time when I'm ready. But what else? I am right now, I'm getting ready to get pregnant, and then I'm going to have to deal with motherhood, and I'm dealing with caring for dying people. What can I do to reduce my risk today? Like, what is in my control right now?
Right.
And, I asked them, what can I do with my lifestyle? And they essentially told me that there wasn't anything I could do because I have a genetic mutation. And that's when I started doing my own research. And that's really what led me to finding the American College of Lifestyle Medicine. I became board certified in lifestyle medicine. I became a certified health and wellness coach, a culinary coach. Like literally the last 10 years, I have done as much training, if not more, on all the things that can help us reduce our risk of disease and live our best life.
It's incredible.
Compared to medical school, because these are all the things that I wish I learned in medical school, but it's just not what we learn, unfortunately.
It's just a different system, right? That's why this Sofia Health and what we're creating exists, right? Like we just had to understand what our healthcare system does for us and not try to push, the preventative everything else into it. Like they do great disease management and they're there to help us with stuff. And the preventative stuff just kind of isn't there, right?
Oh, yeah. And I would also beg to argue that they do great acute care medicine.
Oh, yeah.
Right.
Absolutely.
So like,
oh my gosh, you break your bone, like whatever you've got.
Yeah. I need surgery.
Yeah.
Like, yes.
But unfortunately, we have the chronic disease population and an acute healthcare system, and we don't have, they're not doing the preventative stuff. And it is what it is. Okay. We accept it. Cool. But now we need people like you who have done all this research. You're a lifestyle medicine, you're a coach. Right. So hopefully we can find you on the platform one day and people can reach out. And when they are looking at what else can I do, they have amazing resources to go to get the help they need. Right. That's amazing. Can still access you and all this research you've done.
Absolutely. Yeah. No. And that's the thing. I think what's important to remember is that, especially for women, like all of this is interconnected that we're talking about. Right. And we live in a society today where women are dealing with more in one season of their life than they ever have had to before. They're navigating a career, they're navigating family, they're navigating raising children in silos, they're having children later in life. And so, who knows what is from sleep deprivation of postpartum versus like perimenopause, because you can experience perimenopausal symptoms, 10 to 12 years before you actually hit menopause, right? So most of us are in this phase where we're like in young motherhood, but also in that perimenopausal period. And, we know that once we enter that phase, as we're getting older, menopause, we're at higher risk of things like metabolic syndrome, right? Gaining weight around our midsection, prediabetes, high cholesterol. And we know that as we get older, our risk of breast cancer also goes up. But, when you have these markers of metabolic health, these metabolic syndrome markers like abdominal weight, prediabetes, high cholesterol, high blood pressure, we know that if you have those, if you ever got breast cancer, your prognosis is worse because you have all those underlying risk factors. And so it's kind of like all interconnected, because all the things that you're doing with your lifestyle, right? The food you're eating, the way you're moving your body, the way you're managing your stress, the way you're sleeping, the thoughts you're thinking, the people you're surrounding yourself with, every single one of these lifestyle habits is going to treat all of those things. So it's not like you have to do one thing to reduce risk of breast cancer and one thing to help with menopause or one thing to reduce your risk of heart disease. The science shows that these foundational pillars of lifestyle medicine will reduce your risk of every single major chronic illness while optimizing your quality of life and your longevity. So that's the beautiful thing.
Do you have, like a rapid fire, like, top 5 tips or something that you would, like to overhaul, or, in a perfect world, like what are these? I mean, obviously get sleep or something. Like what are some really good tips that you would have to give people?
From a lifestyle medicine perspective?
From a lifestyle medicine.
it comes back to the thing that I said about genetic testing, right? The first thing that you can do, because every single one of us is in a different season of life. Like everything that I'm doing today, there was no way that I was going to be able to do everything I'm doing today when I was 26, when I had all those things on my plate. Right. Like I'm still busy today, but my season of life is just different. And so I think that's the first thing you have to acknowledge, because January 1st rolls around and we all create these radical lifestyle goals. And by the end of January, all our goals have fallen apart. And so I think when it comes to our everyday lifestyle habits, like, take note of what season of life you're in, what is possible for you, and, pick one pillar and start there and make bite-sized goals that, you can then make into a habit, which will then turn into a sustainable lifestyle for you. And,
I think that's so beautiful, right? Because like, if you're a brand new mom and you have like a week old baby, it's not realistic that you're going to be getting sleep and that you're going to be running or exercising or crazy. Like, it's just not realistic. I think that is just, so simple. And it's just probably something that's overlooked, right? Like you say, like I was at a different season. Now you have older kids, just different season. Oh my gosh. And it kind of gives you the grace to also be like, okay, that's just not where I'm at right now. That's not realistic. So I'm not going to set these unrealistic goals. So thank you, New Year's.
Yeah, absolutely. And I think because this is, life is a marathon.
Yeah.
It's not a sprint.
That's right.
Right? Life is a marathon. And so how can you set yourself up for success in the long run? And if you do, it's about what you're doing most of the time, right? Not what you're doing some of the time. That's really going to make the biggest impact on your longevity. And so one of the biggest mantras that I, really adopted, especially after my surgeries, because I unfortunately had a complication and got pretty sick and dependent on my husband. And, for the first time in my life, like I wasn't able to just get up and go into the bathroom, and I wasn't able to blow dry my own hair, and I wasn't able to go downstairs and make a meal for myself. Like it was an eye-opening experience for a short few weeks, live the life of so many of my debilitated patients. And there was a day where I was literally sitting in the dark waiting for him to come up because I had to pee so bad. And I just couldn't get up. I had all these drains. And that day, I literally said to myself, like, the minute my doctor clears me for movement and exercise, like, I swear I will never take the ability to move my body for granted again. And my mantra became, Robin Arzon she said, self-care is my self-preservation. And that was the first time where I really just put it all together. Like, I have to put my oxygen mask first, allow me to be my best self for my kids in the long run.
So that's something that we talk about on the show all the time, right? Self-care is not go get a manicure. And I really think post-COVID, like, I think people understand that, right? I think employers are understanding that this is not something that's, oh, go take a little walk. This is actually legit how we take care of our mental, physical, emotional, spiritual health. And it's not something that we can blow off for like 5 minutes on a weekend. Like, it's how do we live our lives? And I love how you framed it. What are we doing for the most part? Right?
Yeah. Yeah. And so like, if you think about like the everyday habits, right? Yes, we have had all these advances in society and technology, and we have more resources and advances than ever before, especially in this country. And yet we are the sickest as a population we've ever been. And so we really have to ask the question, like, why? And I always, yes, there's tons of science to prove that lifestyle as medicine works. But I always tell people, like, if you don't want to read the science, if you don't want to get into all of that, go to the blue zones and just look at these populations of people who are just living this lifestyle. It's just part of their everyday life. Like, what is it that they're doing to be able to have the greatest number of centenarians, meaning people living into their 90s and 100 and actively still participating in society? I mean, you would never see that here in America, right? Except for Loma Linda, which is a blue zone. And so I think that is the biggest takeaway. It's the very little things. So, instead of picking up the, packaged snack, which is ultra processed food, can you take a piece of fruit instead?
So very small choices.
Micro choices, right? Micro choices will give you macro results down the road. And so, if you don't have time to work out 30 minutes a day, can you just go for a walk for 10 minutes after your meal? Or can you get up every hour and just walk around for a minute? Like, we have science to show us that even movement in 10-minute increments reduces all-cause mortality, right? And the way that you're managing your stress, you don't have to meditate, but maybe for you, it's getting in a flow state. Are you a painter? Do you, like to, whatever you love to do, it doesn't matter. Like,
and you're driving, right? Just zoning out and driving. Right?
Activate that parasympathetic nervous system, calm down those hormones, and then I think one of the biggest things is, most of us are not in the driver's seat of our life. Like, most of us let other people dictate our life and, what success looks like and what, productivity looks like and all of that. And so I would really say, like, make a checklist of like the people in your life and I'm sorry to say this, but get rid of the toxic people because they are making you sick. Right. And so there is so much beyond it. Like, I always tell people, wellness is a mindset first, right? We have to keep a checklist of like our thoughts and our focus and our beliefs and the people we're surrounding ourselves. Like, you have to approach that part of you first. And once, you've done that, then you can focus on everything you're doing with your body, the food, the movement, all of that. Because if you haven't addressed the mindset, it's going to be very hard to do all of the physical things.
Yeah, that's incredible. It's a circle, right? Like, what are you telling your, yeah, exactly. Yeah, this is great. This has been so amazing. And thank you for sharing your story and your tips with us, and sharing your insights into lifestyle medicine. This is incredible. And then going back, getting board certified, so now you can help others. I think it's just phenomenal. There is a question that we ask all the guests on the show. If you could share 3 fundamental pillars that contribute to your well-being.
So the 3 things that I learned on my journey is that regardless of the circumstances that life throws my way, I have the ability to live in a beautiful state. And that doesn't mean that life isn't going to be hard, but it just means that I can still find beautiful moments even in the difficult times. And what I learned is that it was influenced by 3 major pillars. And I touched on this a little bit. Is number 1 is my focus and my beliefs, right? So I could either choose to focus on the fact that I could die from cancer, or I could choose to focus on all the things that are in my control to reduce my risk of cancer. I could choose to believe that, why do bad things always happen to me? Or I could choose to believe, everything in life is a lesson, an opportunity, or a blessing protecting me for some things, right? How is life happening for me? I really focus on the language I use and the meaning that I attach to the experiences in my life. So like I said, my genetic mutation is a blessing in disguise, right? It's not a curse. And then lastly, our bodies are absolutely phenomenal and magnificent in everything that they can do. Even if they're really sick, they have the ability to heal. And so everything that we do with our physical body, from the food we eat, to the way we hydrate, to the way we breathe, to the way we sleep, and the people that we surround ourselves with, like, it can change your life in an instant. Changing any one of these 3 can change your life in an instant. But we have all the tools available to us to be able to live a very beautiful life.
I think that your outlook on this is just incredible, right? And it just goes to show you how powerful our brains and what we say to ourselves, it really matters. I think that's amazing. Thank you so much for that. And before you go, can you tell our listeners how they can connect with you and find you and get in touch if they need to connect?
Yeah, for sure. I'm mostly on Instagram, although trying to grow some of these other social media platforms, but you can find me at drsimran.malhotra. And then my website is www.coachsimranmd.com. So I have finally stepped away from clinical medicine. So I practiced palliative care for a whole decade, but I'm really excited about everything I'm going to be launching on the coaching side and programs. So look out for that.
Yeah, absolutely. Go follow her, check her out, and get some of her good care, sign up for a program. Thank you so much for being here, Simran. We really appreciate it.
Thanks, Riley.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.